Elizabeth, how are you?
Good.
Nice meeting you. Scoliosis.
Yep.
I'm sure you guys were diagnosed it when she was a teenager or adolescent.
When I was almost 18.
Really? You didn't notice it at all beforehand?
Nope.
Let's check things out a little bit more. So step down, I want to examine you. Let's get some real, what I call scoliosis x-rays, and I'll see you after that. All right, Liz, we're gonna check everything out, all the imaging comprehensively, and then, we'll discuss it later once you've had a chance to look at everything.
Sounds good.
Okay, great. Very nice meeting you.
Joining us now is Dr. Hooman Melamed, and what did you find with her scoliosis?
The only way to fix it is really surgery. You have to do surgery to fix it. Scoliosis is the abnormal curvature of the spine. A lot of people have 20, 30 degree range, not a problem. They go their entire life, no problem. And you could see actually, that's a 71 degree curve, and that's a 54 degree curve on the bottom. And you can see the bottom curve has actually shifted, the bottom part of the body to the left side. You can see, and the head is not exactly 100% lining up with the middle of the pelvis.
What options are there for her?
In her case, the question comes into, would you treat both curves? There are pros and cons of treating both curves. Or you do the upper curve, the 71 degree curve. If you do the upper curve, the 70 degree curve, you leave the bottom curve alone, which means she has all these normal discs, which are important to be functional and do everything you want to do without any restrictions. But she may have pain in the bottom because she's already complaining of pain into her hips. It's a trade-off. And the bottom curve may progress in the next couple of years, and you have to go back in and do surgery to straighten it out. Whereas if you do both curves, obviously longer surgery, so risk a little bit more, but you get a nice balanced spine, but you only have 2 discs in the bottom, which they tend to wear out in the next 20, 25 years, rather than in us sitting here, it would wear out for us in the next 50 years. And the nice thing about it, on the x-ray we saw, the custom rod, there's a new pretty cool technology, whichever option you take. If you take only one curve, but especially the both curves, instead of having to measure the rod during the surgery, cut the rod, and do all this manual labor to get the rod basically custom for her body, you measure the rod before surgery, and right when you're ready, I ask for the rod, it comes in and ready to go. And it exactly fits her body, basically.
And Elizabeth is very excited about her wedding, and she was also worried that she wouldn't be able to have children. But the nice thing about these procedures will be that even if she has some type of procedure, she can still carry a pregnancy, right?
Absolutely. Whether you do both curves or one curve, pregnancy is never a problem in scoliosis. Most importantly, I say, when you do the pregnancy, try to do a vaginal delivery, because instead of a C-section, because they cut the important muscles that are an important part of the core and trunk stability. So you want to preserve all that so you can maintain your core for the rest of your life.
I want to emphasize this for people watching at home. I don't know if you noticed this, but while Dr. Melamed was talking, that's a surgeon who does a lot of cases like this. He's very confident. He knows what needs to be done. What would it mean to you to be able to stand up tall on your wedding day and look at your future spouse in the eye?
Sorry. It would mean everything. Because, I didn't even tell him about it until over 1.5 years into our relationship, because it's just something I'm really embarrassed of, and I just feel ugly all the time, and it just is humiliating. And I hate how I look in my wedding dress because I hate the hump. And I would hate to get to my wedding day and not be able to walk down to him, or have to have somebody help me stand there. But to be able to stand there, that would be such a blessing from God, because right now in my life, I don't see that happening.
If you, get it corrected, first of all, you probably grow at least 2 inches.
Oh, 2 inches. Praise God, I knew that.
And if you guys should get other opinions, no problem, but if you guys choose to go with me, I'm happy to do the surgery free of charge to you guys.
Whoa!
One of the hardest things about all this, I'm such a I didn't want surgery because it would cost them